So now I'm going to show you how to start the St. Ambrose template. And this is specifically for the Interprofessional clinic. Now, it doesn't mean you won't use this during a course assignment or something along that line. But what we want to do is going to go to tag, and we want to go down here and choose SAU. Even though you see PT eval, and you think we're doing a PT eval for the clinic, it doesn't matter. Choose SAU. And you see there's only one selection. So we're going to click that. And what that does, it's going to open up this documentation. And all of our notes are built into this one screen. Okay, so you're going to start like this, and we're assuming we're doing an interprofessional note. So we're going to click interprofessional, and then we're going to assume that, again, this is an initial eval. And we go through and we have all of our different sections here. So I'm not going to go through and type everything in for you, but we'll type a few things in here. So subjective, the first thing we want to do is patient intake. We have the date of the exam, and today's date is 7/17/2019. And you see that kind of comes up already for me. I could just pick that date. Okay, referring provider, we'll say Dr. Handel. Diagnosis, left-sided CVA. And so if you're noticing the right hand side of the screen, things are popping into the box there. We're going to say this patient, I forget the year that I put in for his date of birth, but her date of birth, but we'll just pick one. And Candy's a female, English, and then we kind of go down here. Type of interpreter. If you notice, I'm not checking that, and that won't populate anything. Family member present. We have a daughter and granddaughter. Okay. If there's other caregivers present, I could do that. Maybe you want to know hand dominance, and for someone who's had a stroke, we probably want to know that. So right, we go like that. What that arrow does there, you see it collapses that window for us. It opens it and collapses it. I can go down here in history of current condition, so patient, onset date, maybe she had her stroke back on July 1st. So mechanism of injury, patient suffered a CVA on July 1st. Was with family at the grocery store and began to experience right hand weakness and imbalance. Okay, so we can go through in there and give as much detail as we want. Now, if the person has pain, we can document that, and I'm just going to document this so you see this. So pain present, maybe she has some thoracic spine pain, quality of pain. It's more of a sharp pain when she maybe turns or something like that. If it radiates or anything like this, we could document that. We say sharp pain only when she rolls in bed, any kind of detail like that we want to go. We could say it's intermittent, and we could go through and get the pain rating. So at best, it might be 0. At worst, it might be a 4. And right now, maybe just a little bit of that. Again, rolling. Okay, and we can keep working through here. Previous treatments, if we wanted that. Activities of daily living. This is a nice little box that lets you build things here. So what activity most impacted by your injury? So we can go in here and choose an activity, and we can actually pick what it is. So it might be, for example, walking. Okay, so the limitation, why is she limited? When she's walking for maybe say longer than 10 minutes. The severity, we're probably not going to have on this because this is more pain-based. Functionality, how much is it impacting her function? And that might be a call that you make, let's say 50%. Short-term goal, how much of an improvement do we want? We want it down to maybe 30% in 3 weeks. Long-term goal of 10% or something along that lines. And then time frame, 6 weeks. And again, just kind of making this stuff up as we go. Okay, we could go in here and again choose something else for Again, kind of a functional thing, whether it is, dressing. This would be a great interprofessional goal to think about and work our way through that. Okay. Medical history, as you see here, past medical history, follow up if there's a follow-up session. Some of these things are just there to trigger you to ask these questions or think about this. Others will be a little bit less important based on the client who's in front of you. Okay, maybe this patient has a pacemaker and she's a fall risk. Yes. Number of falls in the past year. Maybe she's fallen twice. And measurement to be taken in PT to reduce fall risk. And we will look at the timed up and go. We'll eventually do that. Other falls have all been, that's more like an other box, but we could later on say falls have been all after the stroke or something like that. Again, you don't have to fill in every box. We go into activities of participation. This gets into more about what the patient needs to do and wants to do. So we have job information, prior level of function when it came to mobility. Candy was independent with all mobility, no reported difficulty. There is some repetitiveness as you see in these type of things. We have job title up here and description of job, but we also have it down here. Walked dog every evening. Okay, these are what she was doing. And we can make these comparisons here now. Unable to walk outside due to balance. We get into living environment. How many stairs does she have? Who does she live with? What type of house? Environmental barriers. And then equipment. Does she have any assistive devices or adaptive equipment? General health status. Again, we get into some risk factors when it comes to she was a previous smoker. Maybe she did 1 pack a day and she quit smoking, back in 2010 or something like that, if we really wanted to get that level. Or she could be a current smoker and she's interested in smoking cessation information. So we had that documented. Drug use, exercise habit, preferred exercise venue, that's helpful there. And again, you see hearing aids, glasses, etc. Goals. These aren't your goals, your therapeutic goals. These are the patient goals. So wants to be able to walk dog again. And then the family maybe be able to leave her at home safely. Okay, so we have all that. And again, all this information is being populated over here. Objective. Now our objective we kept very open in a sense to give you freedom, but also to not make you feel like you had to do something in a certain way. Systems review, kind of a quick assessment of their communication, able to make needs known, and we'll say, but if the person had some issues, we could document that there. Mental function, level of orientation, she's oriented to self, date, location, situation, attention, maybe she's having some trouble with that, executive function, some screens that might take place there. Now we get into the therapeutic notes. Okay, so we have occupational therapy, physical, social work, speech language, pathology. We purposely kept these as just big text boxes because we wanted to let you as the students decide what to put in there. So you could document any kind of special tests you did. If you did, range of motion of the arms, fine motor skills test, whatever it might be along this lines. I will come back a little bit later and show you why that box is there. Okay, again, social work has all these type of things here. Now, these sections down here don't necessarily need to be used. This is a mechanism of the billing dynamics system that these are still present. But with that being said, you could go into musculoskeletal and maybe you went through and did some muscle performance and you want to document all this stuff here. As you start to play with this, you'll see this is very detailed information and probably more than what you need for the health clinic. At this point, we recommend that you do all your documentation of the objective part of the note in these boxes here, and leave these sections, these musculoskeletal areas alone, and not open those things up at this point. But there might be a time that you want to get in there and measure those things here. If there's any kind of overall objective findings you want to put in, you could put in right there, that box. Okay. So now we are done with our objective. We go into assessment, and then here we can go to our diagnosis. We could add our diagnosis code. We already had that selected, I think. I thought we did, but doesn't look like we did. So we can go into here and we'll just pick this. We'll assume this is the one we want just to move this along. Maybe I didn't hit save before. Okay, any more details, we could add that in there. Problem list, impairments, activity, participation. This is following the ICF format. So impairments, this is going to be weakness, range of motion, kind of fine motor skills, activities, walking, balance, dressing, participation, issues that we have with, walking, dog outside. Activity limitations could be, inability to walk for longer than 5 minutes, right-sided weakness in legs, and poor balance. And we might have scores to back that up with as we go. Okay, that's our problem list. Narrative assessment, just a blank box if you'd rather just list everything in that way, more narrative as opposed to using the problem list. Prognosis, what's the patient's prognosis when it comes down to things from reaching therapy goals. I think it's important to acknowledge the patient's strengths. They appear very motivated. They've made great progress so far before seeing you, strong support system, etc. And then any kind of barriers the person might have. Okay, and we get all that stuff done here for our assessment. Okay, and we talked about all those issues here. We'll close that all down so you can see that. Now we can move into our goals. Our goals, again, I'm just thinking very globally. Patient will be able to walk in the for 10 minutes. Baseline can walk for 3 minutes. Standby assistance. Again, baseline there, time frame, how long. So it's going to be how many weeks. It might be 6 weeks we have to get there for her. And again, all this stuff is populating over here. Okay, get into our goals. We get into plan. Okay, so how often we're going to see her, duration. This is somewhat set by the nature of our health clinic. Session duration, again, set by the nature here. This is a good, very important point here to go through and document exactly what you're going to do with her, kind of that overall plan. We're going to work on walking and balance and dressing and ADLs, etc. Direct interventions. This gives you an idea just to go through and click some categories you're going to use with her. So you're going to use gait training with her, therapeutic exercise. This is good practice for the real world when you have to do things like that. You work on cognitive skills. You're going to work on assistive technology and communication. Okay, so you have a list of things you're going to work on. Again, if there's care, family things you need to use, you can do that. Informed consent, just a matter of going through and making sure you documented, reviewed with the patient. Okay, she gave consent. Findings were reviewed again with the patient, and she did not. So this is here. They did give consent, and she did not agree with the findings here. Okay, so it's good to document that just so you have that. Today's treatment. This is specifically what you did today. Okay, so today we worked on 3 walks for 1 minute, walking at this speed, at this distance, whatever it might be. Or we worked on this fine motor skill. We worked on communication, however you might want to do this. And then recommendations for next visit. this is vital to our health clinic that you put very detailed information in here, and not just say work on walking and balance or dressing or ADLs. Give you the next team of students coming in some very specific guidelines on what they need to do at that next visit. Come down here. We do not bill in the clinic, but this is good practice, and this is actually going to be helpful for us to justify the clinic and apply for grants if we think about what would have we billed. Okay, so a PT code, we might come in here, we might say, okay, we're going to build an initial examination, and we did some Therex. Okay, and just do 1 unit, 1 unit. We go down here, maybe OT. We have some codes down here that we did. Again, we might do a Therex for 1 unit. Honestly, it probably doesn't matter too much where did we lost that there. Oh, there we go. You know, where you put the codes at, for the Therex, because you're really treating it all together. Just thinking about the codes adding up to the time that you spent with the client. Okay, so again, outside my wheelhouse here, but evaluate, let's do that, okay? So we have those chosen. We come into here, and we got the CPT codes, and then we go into team members, and we say who the student was, and this was Sally, and the licensed professional was me, Mike Putoff. That's important that you know that. Sally McDonald we'll put in here, and then you're going to put, student OT, OT, therapist, licensed OT, and the same process as you go down here for all these different issues. Okay, for the different professions. You come into here, and now we're pretty much done. What we can do, we can go in here and do a quick read of this, and we can look at this a little bit closer and make sure, okay, do we capture everything we wanted to? We can go into here and hit PDF. We can look at what this might look like as a PDF. We see all the information. We can read it this way and say, oh, we have a typo here at goals. So we can close this down. And this is patient goals. We can go up here to subjective, find goals. Once you go to walk dog again, and say around the block times 2. Okay, we come in here, and that's changed there. We go back to the PDF. Oh, and we can see that will pop up again, and we have that information down here, walk around the block twice. Okay, so now we get this all done, right? And this saves as we go, which is nice, but if we want to, we can hit save that way. And then what we're going to do, we're all done with the note. And we can say we feel good about it, and we can hit sign off. Okay, so now the note has been signed off here, and you can come in here and hit sign. Click the sign box if you're confident in that, how to do that. We will do a different video on how to sign off a note for the clinic, but you'll see you kind of get back to that note. So this is a little bit of a longer one, I know, but this gives you the information about how to do an interprofessional evaluation.